Tonya Henry. I'm from Texas. I'm a military vet, and I just wanted to give you a little bit of history, my backstory. My medical journey with TPN and everything began actually when I was in the military. I was undiagnosed. I was told, you just have a virus, you have IBS, you know, it'll pass, here's some Zofran, let's give you some fluids, and that was in the mid-90s. Well, then after that, long story, it went all the way from there to starting around 1995 to 2014 is when I got my emptying study. So I went all those years not even knowing that I had gastroparesis. So after that, that was at the VA. From that point, I had the test. The doctor gave me Reglan, and the VA said, this is all we have for you. So 2015, my weight drastically reduced. So I asked them, you have to send me somewhere else. And I demanded to go to MD Anderson to see the motility specialist there. So I was there, and we did diet changes for a little bit. After the diet change was not working, so my doctor said, let's do the gastric stimulator. That was in 2015. Then that only worked for about 1.5 years for me. So in 2017, I got a J-tube, which is a jejunostomy, a tube in the small intestine. Then went on tube feeds or enteral nutrition. So that was still 2017. From there, still having issues. So along with MD Anderson, I started going to a tube clinic, which was in Temple, Texas. So one is a little bit north in Texas, and the other one from that point was 4 hours south. And I lived in the middle of both. Then we went from a J-tube from the small intestine to a GJ, and that is, you know, a gastrojejunostomy. So then, after that, still stayed on tube nutrition until 2019 when I'm still having issues. So that's when we went to TPN. And I also at that point went from a GJ to only a G to vent. And ever since 2019, I've been on TPN and still have a G-tube.
So my name is Luccas, and before I just wanted to say how blessed and lucky are we to be here as a community, and thank you to everyone for being here and the whole team for putting this together. And I hope if there's anything you take from today and this week, it's that, you know, it's not just about being alive, but really living, right? And you know, never losing hope throughout any of this. And I think we've heard some amazing stories, and Trinity's story, and about what's possible, you know, with TPN. And you know, my story, I should preface with, I was afraid of needles. So I was 22 years old. I had just graduated from Harvard. I was working on Wall Street and was skiing with friends when I had, you know, lifelong skier, and hit a pole doing about 60 miles an hour in a crazy freak accident. It was enough force that my L2 vertebrae hit the pole and severed the superior mesenteric artery in between. And so I was rushed to the hospital, CPR and an ambulance device, and my heart stopped for 10 minutes, about 30 seconds after I get to the trauma bay, and you know, the doctors went above and beyond. Went through 177 units of blood, lactate above 16, pH below 6.9, I was bleeding out, and really, you know, should not have survived. But they went the extra mile, and that's frankly why I'm still here today. So to clinicians and everyone else in the room, the work that you do really does matter. At the same time, my bowel died from the lack of blood flow, so I have 6 centimeters of duodenum connected straight to transverse colon. So I've been on TPN for 4.5 years. and I get it 12 hours a day, every day. And you know, one of the, when we talk about transitions, Dr. Mercer was one of the first doctors I saw after, and he told me, you know, you got to get used to the new normal. And that was frankly one of the hardest things I've ever heard. And at the time, couldn't have imagined looking back on it, but he was totally right. And if there's anything that I would tell myself at the time, it's that, you know, don't focus on what has to change, because certainly a lot of things will change. But don't let that distract from what doesn't have to change. And there's really no substitute for time. So, as we talk about transitions.
All right, I just wanted to discuss a few of the transitions that I've personally had. That was going from, well, solids to liquids, from liquids to tube nutrition, EN, from EN to TPN or HPN, and also from home to hospital, hospital to rehab, rehab back home, changing different infusion companies, and another transition is also going from having a port to a pig, pig to a Hickman, and the ones that I like and don't like. I personally, I hated my pig line. That was, to me, the worst transition I could ever have. And I am a patient who likes to take care of themselves. So when I had my port, and I had 2 separate ports, I always changed my own port needle. That's something that I love to do. I do have a home nurse, but she didn't really do much for me except draw labs. One thing that they said they required was to have her change my port needle out. And so she came and I said, okay, are you gonna change my port? And she's like, oh, no, go ahead and do it. You know how to do it, I don't need to do that. So I feel that if you can do it and you're comfortable with it, if they're willing to train you and allow you to do that, that is something that I suggest and that I prefer. But as far as going from oral nutrition to EN, I was given my jejunostomy as an outpatient. And so I got my J-tube, I went home the same day, and they said, okay, there you go. But I had no nutrition at all, nothing to go with a J-tube, and my surgery was done 2.5 hours away. I go home and I not immediately, but I would say 3 days later, I had a complication. I woke up to a blood-soaked shirt, covered, bed, everything, and I drove myself to the hospital. The nurse was like, no, I think you need to call 911. I said, no, I got it, I'm just gonna drive. So I drove to the hospital, and I had to get clotting factor. So to me, something that I feel like it should happen when you get any type of tube, a line, or anything is you need to be given the instructions. You need to be given supplies, and if they can't get that to you, you need to be kept inpatient until you can get it. So I did not get my nutrition for 2 weeks. So I was still stuck without anything, even though I had a J-tube. Didn't get set up with home health for 2 weeks. Then I had to go to the VA to get a pump and didn't know how to use it. So that was another one where I had to do my own research to figure out how to use the pump. And then the transition from EN to HPN was a lot smoother because I had a specialized GI team in San Antonio, and my doctor ordered it. I had the pre-labs that were done in my home, and then my nurse came to the house, set it up. She watched me for about 2 hours and said, you're good. She taught me how to set it up. I took my notes. I like to write things down, and I like to have notes for everything. And I posted those notes on my bathroom mirror. That way my daughter can help me if I ever need the help. And I've taught her how to set my TPN up and everything, so she does that for me when I cannot do it. The transition from home to hospital, whenever I've gone, has not gone that well, and I hate being inpatient. So I would say, like, when you're in the hospital, it does not always go as smooth as you would like. And I'm that patient who you bring the medicine in, I'm asking, what is that you're getting ready to hang? And there are times when I will say, nope, I'm sorry, I'm not taking that. And they're like, what? I'm like, no, I'm not taking that. The doctor did not tell me I was taking that, so I'm not gonna do it. Doctor comes in, I hear that you don't want that medication, why not? I said, well, I don't think I need it. And I actually had bacteremia a few years ago, and the doctor said, we're gonna do 2 IV antibiotics. Then the nurse comes in, 3 IV antibiotics. So I'm like, no, I'm not doing that. He said 2, I'm doing 2, not 3. He said, well, you have primary immunodeficiency, and I think you're gonna need a 3rd. And I said, well, I don't think I need a 3rd, so let's just try the 2. So we did the 2, and then that was it. But I mean, it went on and on and on, but I don't think that was my fault. But, so, I can be that patient who is a little, I don't say stubborn, but, you know, I just feel like if I don't need it, I'm not doing it. And I do have a little bit of a medical background as well, so if I don't think I need something, I'm not taking it. I can say the transition from the hospital, the home, to rehab, something that I did like is my infusion company has a VA liaison. So anytime I transition from whether it's home to hospital, hospital to rehab, rehab back home, or even when I went from one branch of my company, infusion company in Austin, to now a branch that's in Minnesota, the VA liaison was there to make that transition as smooth as possible. Anytime I have an issue, I can call her or text her, and she will contact the VA on my behalf. They will work together. The only thing I don't like is sometimes they don't communicate with me. They communicate between each other and not myself. And so we ran into an issue where they decided they were switching my company to a different one, and I said, no, I'm staying with this company. So she had to contact the VA and said, no, the patient wants to stay. And so I said it would have been helpful if someone would have contacted me in the beginning and we wouldn't have had to go through this, because I got a call from the other company saying, hey, we need your information so we can send you your supplies. I said, who are you? She said, I'm your new company. I said, no, you're not, I'm with this company. So then, once I talked to them and got them to talk to me, we worked it out. So I stayed with that company, and I've been with the same infusion company my whole journey. And I don't like change, so I like sticking with that company. When we have problems, we work the problems out. And I feel like that's something, when you're going through a transition, that you have to do, is you have to be able to communicate. And if you are new to TPN, I feel like you should get used to your company, get to know your company, get your contact information, and that'll help make your transition smoother.
So I was asked earlier, you know, we all hear about what does it mean, you know, patients should advocate for themselves, and it's all about communication between patient and their clinicians, and, you know, but what exactly does that mean beyond, you know, advocating for yourself? And you know, in my experience, to patients, I would say 2 things. One is that don't complain, but explain, right? And I think you get taken a hell of a lot more seriously when you can be objective, you know, about what's going on, what you need, what your positions are. And at the same time, you know, I think secondly, you know, maybe Bill Russell, the legendary Celtics player and coach at the same time is a good example, or Tom Brady maybe. To the Boston fans out there. You really are, both the coach and the player at the same time. No one else has the 360 view of everything going on the same way you do. And at the same time, you wouldn't ask, an NFL lineman to go run a 40-yard dash and catch a pass and, score a touchdown. Same thing in the hospital, right? And same thing with everyone involved in your care. Everyone has a role. And it's your job as a patient, really, to map out how everyone fits together. And I remember, some of the first hospital interactions with my mom. Someone would come in to clean the room, and she'd bombard them with a list of questions, and you could see them glossy-eyed, like, whoa, I have no idea what's going on. But it's true, and even if you're going to IR to get a central line placed, they're not used to placing central lines for TPN, and so you might tell them, hey, instead of putting the cuff right at the edge where it's easier to pull out, I'm going to stick with this for a long time, so put it higher up, and not just a little bit higher, but up by my collarbone, whatever the example might be. But I think that's an example of if you give people context, and you give people context of how that fits into the broader care plan and your broader experience, that tends to work really well. At the same time, for clinicians, one of the phrases that stuck with me was, remember what it was like to not know. And I was 22 when this all happened, when I started on TPN, 23 when I got home. And I couldn't have imagined, the perspective and how time would change things. And there really is no substitute for time. As a patient, your perspective really does change. And I think maintaining hope throughout all of it is sometimes just gets tomorrow. And know that it gets better. But to clinicians, this is, you might be seeing someone for, what is their first time, and you might have, a view of what's to come and what's around the corner, and giving them that perspective of, this is trying to remember what they know now and what they will know, and just keeping that in mind when giving them, advice, perspective. And the other thing is just going the extra mile really does make a difference. I think it's the easiest thing sometimes to stick to a normal course of action, but when you engage with the patients and when it goes well, you have those goals. You saw from plenty of stories today, and you'll continue to hear about some really incredible things that people do on TPN, on any kind of nutrition support, and that really shouldn't limit you. And it really is coordinating with everyone involved to come up with a safe plan. But to clinicians, when you go the extra mile, it might not be easy, it might not be convenient, but it really makes a hell of a difference for quality of life. And I think that's really the whole point, isn't it?
Thank you both. Well, and it sounds like, if I were to summarize, Tonya, it sounds like what has helped you kind of be ready with your transition, because you've taken a very active role in ownership of managing your line and your therapies. And I think sounds like that probably helps you be ready when you're doing these transitions and be more prepared. And I heard lots of communication, right? Communication is key. And with Luccas, it sounds like perspective, right? You're looking at things differently. Your journeys have both been different, but you have these perspectives and experiences. And we don't have much time, but if you had something that you were going to tell somebody who's earlier on in their journey, something that you had wished you had heard, or if there's something that someone had said to you that really was able to kind of shift your mindset, even if you weren't feeling quite ready for that transition, if you would just share.
I would just say, whatever the doctor tells you, when he tells you a condition that you have, or you're going to have to get a port, or they say they want to place a line or a tube, it's very important to know exactly what types of tubes there are Are you getting a nasal? Is it going to be a surgical tube? What kind of line am I going to get? Ask those questions. Where is it going to be? Do I have a choice in the type of line or the type of tube or anything? So I feel like asking questions, doing your research, and finding support groups, those are the things that I would suggest for anyone who's new or anyone who is already in that journey but you don't have a connection. There are lots of groups out there that you can find to connect to.
And I think I would just add that don't let your own mental blocks limit you. You know, I don't think there's, you know, when I first had the accident, I think there was a lot of, you know, oh, my life is totally different. You know, a lot of focus on, I can't do this, I can't do that. But at the same time, it's, you know, when you stick with it and you're like, well, you know, I think that's a really good point. Don't stop asking questions. Well, you know, I want to travel. Well, you know, I can still travel. Yeah, I have to pack a couple things more, but you can still travel. You know, I want to play sports. Well, I've got to be careful with the line, but you know, I still play soccer. I still ski. And to anyone, I'd say, you know, don't let your own mental blocks, you know, limit you. Keep asking questions, and if there's something you want to do, you know, more often than not, I think you can figure out a way to go do it. With, you know, working with your team, working with your family, working with everyone involved, but there's a way to go do anything you want to go do.
Thank you. Well, and now that we've talked about, you know, readiness and how to be ready, we're going to talk about ownership. So who is owning what? And so now I'll invite Marie and Kaylee up to the